Now at 6:30, 2 years ago today, Oregon confirmed its first case of COVID-19. Dr. Katie Sharff, chief of infectious disease at Kaiser Permanente Northwest, was the doctor who made that diagnosis. Fox 12's Chandler Watkins spoke with Dr. Sharff on the last 2 years.
With us entering year 3 of this pandemic, Dr. Sharff says while it feels like that diagnosis was a lifetime ago, we're not in the same situation we were in 2020, with many advances being made in healthcare preventing and treating COVID-19.
It really has been a couple of years of vast learning and shift in perspective.
On February 28, 2020, Dr. Katie Sharff diagnosed Hector Calderon as patient 0 in Oregon. He was the first confirmed COVID case in the state and the second patient in the nation determined to have contracted the virus through community spread. He was later discharged from the hospital after over 2 months of treatment. While so much has happened over the last 2 years, Dr. Sharff is optimistic moving forward.
We have so many new tools between safe and effective vaccines, improved testing capacity, new treatments, that I'm optimistic and hopeful that things will be brighter ahead.
Despite the state seeing a decrease in COVID cases and hospitalizations, Dr. Sharff says there's talk amongst experts that COVID could become an endemic, meaning we'll always live with it. Looking towards the future, Dr. Sharff says there will be 2 critical things the healthcare community will need to work on: making up missed preventative healthcare like cancer screenings and rebuilding trust between the community and public healthcare experts.
We have been living this pandemic and seeing science evolve in real time, and at times the messaging has been confusing. Rebuilding that trust and confidence in public health will be critical going forward. Not only for this pandemic, but for preventative care and healthcare in the future.
With today's news that the mask mandate will be lifted earlier than expected, Dr. Sharff says she sees why the mandate is lifting, but says it's not a one-size-fits-all situation. With individuals who are immunocompromised, have underlying health conditions, or who are not eligible to receive the vaccine, she says it's our duty as community members and neighbors to understand why some may want to leave the mask on after the mandate is lifted. Reporting in studio, Chandler Watkins, Fox 12 Oregon.